Do you ever get overly bloated, feel like you're distended, get extra gas or flatulence, or maybe even stomach pain or GERD sometime in the next 30 minutes after you eat? If so, I want to let you know this is incredibly common, though it's not normal. Hello, I'm Dr. Brandon here at Functionized Fit Clinic right here in Colts, New Jersey, and I just want to spend a couple of quick moments with you guys telling you about some very simple behavioral changes that can negate these stomach symptoms after eating well over 90% of the time. And even if these aren't things that directly fully resolve your issue, I'm pretty darn confident doing all these things will make it a little bit better. And then if you need more focused help, you can always ask, and I'm here to listen. So the first simple thing that a lot of us do is simply eating too quickly. And most of us do this. Right? The faster we eat or even drink or taking in more seltzers or bubbly fluids in general causes CO2 to build up. It fills up the space. Acid in our stomach raises up more. We are more likely to distend, either coming outward or have everything bubble up, and it gets incredibly uncomfortable. This is something easy to solve. You can go with the whole idea of chew X amount of times, but it's also just talking to someone, eating a meal with somebody else. If you're talking, you're not able to put food as quickly into your face, and that's a simple way of helping. When we're hungry, we tend to eat faster anyway. So as long as we're cognizant of it and we can take a little control and slow it down, this reduces it for a lot of us. Another big one is know what your trigger foods are. I run food sensitivity testing all the time here to know which foods it is that we are eating as an individual that causes inflammation, and again, stomach distension, bloating, harder ability for us to absorb what we're eating. And it's a very simple blood test. That is what I think is the easy way. There's also the elimination diet, which is far more structured, more time consuming, and a little bit more difficult for the individual to hold to, but still lets us know what foods are causing reactions. So you can food journal to know what these trigger foods are, because odds are it's not everything you're eating unless you're just eating too quickly. But there can be nutritious food for you that causes your body to respond. Very similar to what an allergy can do, it just gives us different symptoms. Another increasingly common issue is pancreatic insufficiency. I've even seen commercials on the medical side for this. It's where it appears to be from chronic levels of high inflammation going mildly autoimmune to where your body isn't making the enzymes it needs to break down food. So if you can't break down what you're eating, our body responds. And it usually comes in ways of, again, any type of gastric discomfort, the bloating, the GERD, or not being able to go to the bathroom properly. Maybe you're constipated, maybe it's coming out not solid or not doing it correctly all the time. And we should have, for lack of better terms, solid stool all the time. Having it once a week, being constipated or too loose, again, that might be common, but it's not normal. It's not the way that we're meant to be, and then it lets us know that there's an issue going on. So if this is the case, it's a very simple test of taking digestive enzymes about 15 minutes before you eat, and the symptoms either they stay there or they go away. This has been surprisingly effective statistically on the number of people this works on, well over 95% of the people I see. And then that's still a band-aid. We still have to do all the lifestyle changes to figure out why are we having pancreatic insufficiency, what's causing inflammation for this to happen. But at that point, that's the details and that's the easy part. Another possibility that's common for people is a gut dysbiosis. Not having enough of the right bacteria, either too much or too little in our stomach and our intestines. This is where a probiotic can come into play if you are too low in bacteria. But if you're on the cusp of being borderline too high or too high, a probiotic is more bacteria. And I've seen that cause bacterial issues by getting too much. So if you're not sure if this is a case for you or if it's too low or too high, that's where you can talk to a competent medical professional and help diagnose and treat that issue. Lastly is consistency, and this is the hardest part for everyone, is doing everything all of the time, right? And part of that consistency is when are you eating? Our bodies, for most things, like regularity, it likes routine. So if you can eat meals about the same time every day, our body seems to respond a lot better. Specifically, down in our gut. If we can have, well, however many meals you have, 1, 2, 3 or more, have it roughly the same time of day, and making sure it's not too late at night within 2 hours of bed, because sometimes that can cause little gut disruptions. But the consistency is a big deal as well. So if you can make these changes, I would expect you to have improvement at the very least in any type of stomach issues you might have. And if it helps get you partially there and you feel like you need more assistance, always feel free to reach out to us here at Functionize. We're the Fit Clinic right here in Colts, New Jersey, and we will do an individualized assessment to know what exactly is going on, so we're not guessing with statistics, because every individual is different, so your health has to be treated a little bit differently as well. If you have any questions, please do reach out. We're here for you. I'll talk to you guys again soon. Thank you.